Great. Well, thank you all for coming today. My name is Robert Sprague, State Representative from the 83rd House District. And first of all, I wanted to, before we begin, take a moment to thank Attorney General Mike DeWine for allowing us to hold this press conference in his press conference room today. I'd also like to thank my colleague, Chairman Ryan Smith, for joining us. He's been a leader on this issue in the Ohio House. And we'll hear from both of them in just a minute. I wanted to lay out, first of all, the situation in the state of Ohio. The heroin and prescription narcotic epidemic nationwide has now killed more Americans than the Vietnam War. Last year in Ohio, 2,482 Ohioans died of a drug overdose, putting Ohio second in the nation for drug overdose deaths. And the number of overdoses continues to climb each year. How did this happen in Ohio? 10 years ago, heroin addiction was practically non-existent in our state. What could possibly have caused this unrelenting addiction epidemic that has spread into every city center, every suburb, small town, and farm community in Ohio? What has suddenly caused this scourge that rips people away from their families and in many cases leaves them to die alone? If we only knew why this was happening, we would confront it, we would fix it, we would stop it. How could so many people in our great state become addicted to narcotics? And the answer is, they took a pill. You see, for the last 10 years, our medical system utilization of prescription opioids has steadily increased. Prescription narcotics are prescribed for nearly every condition: acute pain, chronic pain, breakthrough pain, headache pain, back pain, you name it. We've got a fancy narcotic pill that we can prescribe to take away that pain. The only problem is that these narcotic pills are also addictive, and they have this same active ingredient as heroin. So our medical system has increased its use of prescription narcotics nearly tenfold in the last decade, and the rate of addiction to narcotics has increased in lockstep. So here today, we are to talk about the new CDC guidelines for prescribing opiates, the new CDC rules for prescribing opiates. And in December, the CDC has drawn a line in the sand, creating new nationwide rules to help end the irresponsible prescribing of narcotics. And today I'm announcing my wholehearted support for these rules in a letter that I will be submitting to the CDC during their comment period for these new rules. And furthermore, today I want to call on every mother and father, family member, or friend who's been affected by somebody who has become addicted to narcotics. And I ask you to please take 10 minutes out of your day on Tuesday or Wednesday and go to the CDC website and submit a comment yourself on these new guidelines. By working together, lawmakers, prescribers, hospitals, law enforcement, the justice system, and patients, we can change the prescribing habits for narcotics in Ohio and eventually put an end to our heroin epidemic. An overview of the proposed CDC guidelines for prescribing opioids for chronic pain. They are very reasonable. First of all, one of the fundamental tenets is that it's better to use non-narcotic treatment for pain instead of narcotics, and those treatments should be tried first. Secondly, if narcotics are prescribed for pain, they need to be for very short periods of time, for about 3 days for acute pain. Third, if narcotics are used for long-term pain, they need to be in lower dosages, and they need to be very closely monitored for success or failure or addiction. And finally, if monitoring does discover addiction, these patients need to be immediately referred to treatment and be enrolled in medication-assisted treatment programs. So at this point, in light of the recent 12 overdoses in Wilmington, Ohio, I wanted to take just a couple minutes and have Chairman Ryan Smith come forward and talk about some of the work that has been done in the Ohio House of Representatives already on this particular issue. Chairman Smith has been a tireless advocate for trying to address the heroin problem. I know that it affects his district as it affects mine, and together we've worked on a number of pieces of legislation over the past few years. Chairman Smith.
Thank you. So in 2012, when I came to the Ohio House of Representatives, it was apparent to me that we had a huge opiate epidemic in southeastern Ohio. With Robert's leadership in the last GA, particularly where he led a statewide task force to go around and hear testimony all throughout the state, it became very apparent that it's not just southeastern Ohio. It's pervasive all throughout. So we set forth to help craft a comprehensive opiate epidemic response plan, if you will, a comprehensive plan, both from start to finish, and tried to touch all the bases that we could. I'll mention a few of these today, although there are probably far more. On the prevention side, we started out with including in health curriculums in our education on prescription medications and heroin addiction. We also named the first Friday in May as designated as Prescription Drug Abuse Awareness and Education Day. The first week of July is Neonatal Abstinence Syndrome and Awareness Week. Those types of things help raise the awareness, and certainly anything we can do will help there. We've seen a lot of youth-led prevention programs, which I'm particularly proud of, that I think are making a huge difference all throughout the state. From there, we started to look at the prescribing habits of our prescribers. We have a prescription monitoring program called the Ohio Automated RX Reporting System, or the ORS program for short. What we found was it was underutilized by the prescribers of narcotics. So we increased the awareness of that by requiring anybody writing a narcotic to check the ORS program, which cuts down on doctor shopping. Also helps with the clinical aspect of the patient, and I think the medical community has done a very good job moving in that direction. Even prior to that, the pill mill legislation, which really stopped the spread of opiates, just writing prescriptions one after another, and slowed things down considerably. We added a parental consent bill for narcotics being prescribed to a child, and as a father of 4 and Robert's father of 5, it was important to us that we protect the families in the state of Ohio. And from there, we also passed legislation for access to naloxone, the life-saving drug that we've read so much about, that is far more common for our first responders, and now also moving on to individuals to help save lives in the event of an overdose. We've on the treatment end, we added capacity for recovery beds throughout the state. We've worked hard on that front. Certainly opened up a lot of access there and have more to go. Created the medication assisted treatment programs throughout the state that have done very well. Throughout the last 2 budgets ago, we started that program. We added more dollars into it in the last budget. Very proud of the results we're seeing there. Established funding for the Supreme Court certified drug court programs. Again, very important component of fighting this epidemic. And the programs have been created to support treatments of prisoners that have an addiction. Just in this last budget, both Director Moore and Director Plock have worked hard on this. I think it's going to really do well. This is just a snippet of what we've done, but it gives you an idea of all the bases we tried to cover in light of, as Robert said, what's happened in Wilmington and Dayton and other places like that. We feel like we're making progress in this effort. We obviously have a long way to go, and with everybody's help, and certainly the Attorney General's leadership on the issue, I think we're going to continue to make progress in this.